Hi, I'm Sandy from Maryville University, and I'm here to do the head-to-toe assessment. This is my assistant, Patty, a good friend, and she's going to be my patient for the day. So we're going to get started, and prior to Patty coming in here, I had her empty her bladder. We got a full set of vital signs. We got her height, her weight. We also checked her eyesight. We checked near vision with the Rosenbaum, and we checked far vision with the Snellen test. And she did really well on all of them. And I washed my hands. So we're going to get started today, Patty. First of all, I'm going to start out, and I'm just kind of assessing you when I walk in the room, looking at you, and I'm going to start at your skull. And I'm feeling for any type of masses, nodules, indentations, and it looks good. And the skin moves freely on her head, so that looks really good. I'm looking at her hair. Her hair is not dry or brittle. It looks really good and shiny. And there's no signs of alopecia anywhere. So next I'm going to palpate her face. And I'm going to start out by palpating the facial bones. And if you feel any pain, Patty, let me know. Any pain at all? No. Okay. And now I'm going to ask you to open and close your mouth. We're checking the temporomandibular joint, and there was no popping or cracking on that. So next what we're going to do is I'm going to check your sinuses, and I'm looking for any type of fullness. Is there any pain there? No. Okay. And the lateral apparatus, and no pain there either. Okay. So I'm going to do a test now, and I'm actually going to tell me if you feel this. And so I'm going to have you close your eyes and tell me where you feel it.
Forehead, chin, cheek, cheek.
Great. And did you feel any difference between the two? No. Okay, good. Now I'm going to ask you to do a few facial movements for me. And this is checking your cranial nerves. So if you could squeeze your eyes tight, wrinkle your forehead, clench your teeth, puff out your cheeks, and stick your tongue out. Good. And what I'm looking for is that it's all symmetrical, and it looked really good. So next we're going to go to the eyes, and what I'm looking at is first to see if they're spaced even, and if they're symmetrical, which they are. Her eyebrows go across her eyes, and they're fully distributed. I'm looking at the eyelid that covers the eye, and I'm looking at the eyelashes that turn out, and that's all good. So what we're going to do now is check the sclera and the conjunctiva. Good. And I had Patty look up on that. We looked at it. It's not red, and it's pink, and there's no signs of paleness, so that looks good as well. So next I'm going to check your pupils, and I'm looking to see if they constrict. This is direct, concentric, direct, concentric. Good, and they restricted good. So next I'm going to check your ocular movement. If you could follow my flashlight and keep your head totally still. And this, what we're looking for for Patty is to see if her eyes move smoothly, no jerking, and it looked great. She had no problems at all. Next, I'm going to ask you to do eye test and just cover one eye for me. Okay, uncover. Okay, and now the other eye. Good. And what I'm looking for is to see if this eye remains focused and it doesn't deviate to one side or the other. Okay, so next what I'm going to do is I'm going to go to your ears, and what I'm going to do there is I'm going to palpate, see if the cartridge is good. Is there any pain when I do that, Patty?
No.
Okay, and there's no redness around the ears, so that looks good. Now I'm going to go through a series of hearing tests. I'm going to go behind, whisper a word, and you tell me what the word is.
Orange. Orange.
Apple.
Apple.
Great. Okay, so then I have a tuning fork here and these prongs, and what I'm going to do is they vibrate. So I'm going to put this on your head, and you tell me if you hear this equally in both ears or one ear or the other.
Both.
So both ears you had no problem with. Again, I'm going to do it this time. I'm going to put it behind your ear. I'm putting it. And tell me when you quit hearing it.
Now.
Okay, and again.
No.
Great. Okay, so that just goes to show that air is less than, or bone is less than air conductive. Okay, so we're now going to look at the nose. The nose is midline. There's no deviation. We're going to check for patency, so if you could close one of your nostrils and breathe in. Good. The other one? Good. So she's not having any problems breathing, and that went well. So I need to look inside your nose. And her mucosa is pink. She has evenly distributed hair, and the turbulence looks really good. So next we're going to go to the mouth. And what I'm looking at is her lips, and I want to make sure that there's no cracks, fissures, sores, and they're not. And then I'm going to check her gums to make sure they're non-recessed. I'm going to check her teeth, the number, any broken, any deformities there. And I'm also going to check her tongue, underneath her tongue, because that's a place that you really want to watch. So if you could open your mouth, tip your head back, okay. And what I'm looking at is the hard palate, soft palate, the orthopharynx, the pharynx, the tonsillar pillars, and it looks good. There's no problems. And if you could lift your tongue up for me, okay, and to the side, to the other side. Good, okay. And there I didn't see anything under her tongue, so that looked good as well. I'm also going to look at, now we're going to move to the neck, and I'm looking at her neck to see if it's midline on her shoulders, and it looks like it is. It's not forward or backwards. So what we're looking at now is she doesn't have any jugular vein distension. I'm going to check your carotids, and we're going to only do one of these at a time. Okay, good. And next we're going to check the trachea. It's midline. There's no tracheal tug. And then I'm going to check her thyroid, and I'm going to just move it to the side and ask her to swallow. Okay, good. And the other side? Good. And there's no nodules. It's smooth, it moves well, and it doesn't appear to be enlarged. Okay, so now we've checked the thyroid, and we've checked the neck, so we're going to move to the lymph nodes. And so at this point I'm going to check the occipital lymph nodes, the preortical, the postortical, the posterior cervical, the anterior cervical, the interclavicular, the infraclavicular, the submandible, and the mandible. And that's good too. I don't feel anything there, so that's good. Next I'm going to look at her chest, and I'm observing, and I see her respirations are easy and even. I see no thrills or heaves or abnormal palpations. So now what I'm going to do is I'm going to check her heart. I'm going to feel again for heaves and lifts, and I'm going to start here at the apex, the left sternal border, and the base. And I'm going to check for the apical pulse. She has a strong apical pulse, and that sounds good. I'm then going to listen to the heart sounds. And what I'm listening for is any murmurs, any S3s or S4s. And I'm starting out with the aorta, the pulmonic, tricuspid, the mitral, and that all sounds good too. So next I'm going to do some palpating on your chest, And I'm looking for any soreness or any abnormalities. So I'm just going to systematically palpate. Any pain there, Patty?
No.
Okay, good. And so that looks good too as well, is no problem. Now I'm going to ask you to, I'm going to actually listen to your carotid arteries with the bell. And I'm listening for any breweries, which Patty didn't have. So that's good. So now we're going to have you turn around if you could. So now I'm looking at her chest to see how her respirations are, if her chest rises and falls evenly. Her respirations we saw earlier was 12, and so we're just looking at the configuration. So in the configuration, the thoracic configuration looks good, and we know that the AP is 1 to 2. So next I'm going to look at the expansion, and I'm going to do that by placing my hands, Patty, right at the bottom of your ribs, and I'm going to ask you to take a deep breath and out. Good. And my thumbs pulled apart, so that's what I was looking for, and so that looks good as well. Next we're going to do what we the costovertebral angle. And this should not elicit pain, Patty, but I'm going to just palpate you down here. Any pain?
No.
Again?
No.
Good. And if we had pain there, that would mean that she has some irritation in her kidneys. Okay, so next we're going to do what we call the diaphragmatic excursion. And what we're doing there is we're going to be measuring the expansion. So Patty, if you could just lean forward a little bit and your arms forward. Good. And what we're going to do is we're going to palpate down till we hear a change in sound, which is right there. So I'm going to mark that with a pen, okay? And now I'm going to have you let your breath out. And now take a couple breaths and then push your breath out and hold it. Great, and I'm going to mark it right there. So that we would do on both sides, but due to time, we're not going to do that. I'm next going to palpate Patty's back, and again, to see if there's any tenderness, any abnormalities. And I'm doing this systematically, and I'm doing it to compare. Okay, good. Next, Patty, I'm going to have you do some tactile phremesis, and what that is I'm going to lay my hands on your back, and you need to say 99.
99.
Again?
99.
Okay.
99. 99.
Okay. And actually, I'm going to do that on the other side too. Again?
99. 99. 99.
Good. Okay. And we're looking for vibration. If we had a lot of vibration, it could mean fluid. So we're looking at that. So next I'm going to palpate the lateral side. So Patty, if you could lift your arms up. Okay. And you can do it and compare both sides. So now I'm looking at, I'm going to listen to her breath sounds. And I need you to take a deep breath through your mouth, in and out, slow and easy. Okay, and And what I'm looking for there is any rales, any ronchis, any, any type of wheezing, that type of thing. Okay, so Patty, now I'm going to have you lay down. And I'm now looking, I'm going to just pull your shirt up a little bit. Okay, good. I'm now looking at her abdomen. I'm looking at the contour and the shape. Her stomach is flat. It's pink. It's healthy. There's no palpitations that I can note. I'm then going to auscultate, because you always want to auscultate first, because if you palpate, it could alter the vowel sounds. So I'm starting with the right lower quad, left lower quad, left upper quad, right upper quad. Now I would listen to these for at least 2 to 5 minutes in each area, each quad, if I didn't hear anything. So up to 5 minutes. And she has vowel sounds, and you'd be listening for hyperactive vowel sounds, or obviously absence of vowel sounds. So next I'm going to listen to the aorta. And this by bell. I don't have a bell on my scope, so we'll pretend. Okay, then I'm going to listen to the right renal artery, the left renal artery, the right iliac artery, the left iliac artery, and the femoral. Okay, good. And again, I'm looking for bruits. And Patty didn't have any, so that looks good. So next I'm going to do some light palpation. And what I'm looking for there is just any abnormalities, any masses, any discomfort, tenderness. Patty, do you have any discomfort?
No.
There's no pulsations, and it looks good. So next I'm going to do some deep palpations, and what I'm going to do there, again, I'm looking to see if there's any tenderness. All right. Next I'm going to actually check the liver borders and I'm going to get right up under the ribs. Could you take a deep breath in? Okay, good. All right. And next I'm going to palpate the spleen. So if you could turn on your left side and take a deep breath. Okay. And you shouldn't be able to palpate the spine or the spleen if it should not be able to, and if it is, it's probably enlarged. Okay, that looks good as well. All right, so next I'm going to now have, put this down for you. Next I'm going to have Patty set up on the edge of the bed. And I'm going to check your arms, and I'm looking at muscular, I'm looking at distributed of a hair. Her nail beds are pink with a brisk capillary refill of 3 seconds and less. And even hair distribution. Next, I'm going to have you hold your arms out to your side and resist me pulling down. Okay, good. And now in front. We'll do it again. Okay, good. All right. I'm going to check your pulses, the radials, and the brachials. The popliteals, the dorsalis pedis, and the inferior tibia. Okay, good. So next I'm going to check your reflexes, and I'm just going to check first your brachial. So if you can just lay your arm across mine, okay. Good. Okay. Next, your radial. Okay, and again this one. Okay, and your radio. Okay, good. Next we're going to check your popliteal reflexes. Okay, and again. All right, and the Achilles. Okay. Good, all right. If you could stand up for me. And what I'm going to ask you to do now is bend over and kind of bend over real far if you could. And I'm looking at her cervical spine. It's not curved, it's concaved, it's in alignment. And do you have any pain doing that at all, Patty?
No.
Okay, good. You can come up now. And that concludes our assessment. Thank you very much.